Welcome to the Healers Café, the #1 show for medical practitioners and holistic healers to have heart-to-heart conversations about their day-to-day lives while sharing their expertise for improving your health and wellness. Welcome to the Healers Cafe, and today I'm with Dr. Tom Ingegno, and he is a doctor of acupuncture and Chinese medicine. He also has experience with integrative and functional medicine, and he's been a big contributor to two prestigious schools for East Asian medicine to really expand the scope of practice of acupuncture with his role as chairman of the Maryland State Board of Acupuncture. And I don't want to go on to too much. You've got books and things on cupping and things we will definitely discuss. But why don't we just start with what brought you into Chinese medicine and what got you attracted to that whole field to begin with?
I can start with a memory that I had. My grandfather was a pharmacist, and I talk about this a lot. I mean, he was a big influence in my life, and I used to help out in the pharmacy as a teenager. And he was counting out pills, and back in the day, you didn't have machines doing it; you did it by hand. And he's counting them out on a tray, and he happened to be counting them out for a guy that had no insurance, and he was a day laborer. So, he might be making 40, $50 a day tops.
Mm.
And my grandfather said this guy's got to take 3 pills a day for the rest of his life, and they're $5 a piece. And for this guy, that's a significant amount of money.
Yeah.
And he looked at me and he said, "There's got to be a better way, and hopefully you find it."
Well,
And that kind of got buried somewhere in the back of my head. I thought I was going to be an MD. I think a lot of us that come into I don't even want to call it alternative, but non mainstream medicine.
yeah.
Think that, MD, nurse, something like that is the only path. And when I got to college and I started looking around, I saw some very interesting things. And I took a Chinese philosophy class, and it was like, wow, I like this concept of balance.
Yeah.
And as I learned more and more, I really got intrigued by acupuncture and the theory that involves all East Asian medicine. And I got a postcard in the mail from an acupuncture school during my junior year of college, and 2 weeks later, I was enrolled. There was no looking back.
Okay. So was that a coincidental postcard
I
or?
I would say many of the big things that have happened in my career have been an act of serendipity. We'll call it that. And
Yeah, I think so. It's more likely than coincidence. I don't actually.
I was being driven, and it wasn't always me doing the driving.
There you go. So what is it that you or how long you've been, like 20 years or 25 years?
It'll be 23 years in
Wow,
May.
amazing. And
Yeah.
and so what would you say that you enjoy the most about your practice?
My practice specifically. I like the fact that in my clinic I can evolve it to be whatever it wants, right? So we offer a lot of services that are I don't like using the word cutting edge. I think it's used so much. But we do cryotherapy, we have cold plunge, we have saunas, we have red light
Wow.
therapy. And in my head, that all makes sense to me from an East Asian medicine standpoint,
Mhm,
right?
mhm,
Treating the whole body, doing something in an attempt to balance something else out,
mhm,
rather than just this is something new and trendy. I mean, there's plenty of new and trendy services. We don't add them just because of that.
mhm,
It has to work with our central theme, which is reducing inflammation, improving circulation, regulating immune system function, and reducing stress. And almost every one of those services hits more than one of those things, and all of those principles are something that happens with acupuncture.
mhm, mhm. So, I have a kind of an open discussion on sometimes it's the nitty-gritty of setting up your business.
Yeah.
Sometimes it's a fascinating subject or something, but I'm really tempted to ask you because it sounds like it's a big thing to organize these separate
Yeah.
rooms, these. So how did all that manifest? And can you share?
I will tell you a story about one of my other big influences in my life, which was my mentor.
Mhm.
Acupuncture, even today, is not for the faint of heart. As far as practitioners, we
Right,
still have a high burnout rate. Many of us don't make it past 5 years. Um,
right. I didn't know that.
yeah, it's better than it was when I started. And
Mhm.
certainly having insurance coverage and seeing all this great data and studies that are coming out that are saying
Yeah, that
things
it
that are even
works.
better than I could have hoped
Yeah.
about acupuncture have helped. But having a mentor, somebody that really walked the walk, and he lived in China for 12 years, he lived in Japan for a decade, and he studied acupuncture that whole time. He was licensed in 4 different countries. Within that, when he brought acupuncture to our school, right? He was brought back by a friend of his that he met in the 80s in Japan. He kind of guided me and said, "Look, this is how you survive," and not in those words, but here's how you get your skills up. Here's how you talk about what you do.
Mhm.
And when I was before I signed this lease, because this particular incarnation, my clinic started in 2016.
Okay.
Um, I had talked to him about 3 options I was entertaining. This big swing, the place that I'm in now, versus cutting the 6 rooms I had down to 2 rooms, getting rid of all my renters and just grinding. And the third option, and I don't want to get too political, but this was before our previous president was even a serious contender. I said, "Oh, he's not going to become president, but just in case, should I just go to Costa Rica, up the whole family and move?" And I could see 10 patients a week and probably do okay there. And
Mhm.
my wife's a Montessori teacher; she can teach in one of the bilingual Montessori schools, and we'll yeah, and he looked at me, he said, "Well, you like being around other people. So that 2 room clinic is going to drive you nuts. You'll get so lonely." And then he said, "And yeah, it sounds great to sit on the beach all day." I'd give you 3 months before you're lighting fires. Uh, so without pushing me towards the third option, he had me leaning in that direction.
Mhm.
And I had to learn a lot of business. That's not a concentration. There are some practitioners, some disciplines where like you get a lot of business school when you're getting your
Yeah,
license,
like
and or
chiropractors.
yeah, well, I didn't want to throw any rocks, but sure.
But it's
Um, but yeah, and that's not like we didn't know what to charge. We didn't know what we should be paying for rent. We didn't know how to
yeah.
structure our companies. Hell, my business guy didn't even teach me how to bill insurance. So there was a steep learning curve. And then to
Yeah.
add in other services was this it was a monster. I would joke and say I had hair before it all started, but I didn't. Uh um but certainly it wore me down for a while, and there was a lot of figuring out those little moving pieces. Like we wanted to make sure that people got the most out of their treatments, and how do we organize even these services together. And
Right.
we came up with stacking, and it was this concept of somebody came in and said X, Y, and Z. Well, here's a stack that goes well together. So if
Uh,
you're coming in, and you work out a lot, and you maybe don't have any injuries, but you need some recovery, this is what we would recommend. Here's the price, right?
mm,
We have memberships, which is like functionally like a gym.
yeah,
It's
yeah,
what
yeah.
why? Because I want you to come in to use the stuff. I'm not
Right.
going with that gym model like I want millions of members that never show up. I
Yeah.
want people that are committed to their health, that know that when they come in regularly can check in with us and talk
Yeah.
to the staff and say, "This is how I'm feeling. What do you recommend?"
Yeah.
And try to redefine that paradigm where like I go and I get my blood work and I get my blood pressure checked, and maybe I get some extra exam because I'm a certain age, into here's the snapshot of your health, taking it from that model to how do we actively guide you down the road you want. which is really how acupuncture and all of East Asian medicine really excels. Don't wait
Right.
until you're broken. Come in,
Yeah.
get the services you need beforehand, and hopefully you sidestep all of that.
Yeah. Yeah.
And yeah, we after a few years, and I will say, COVID kind of reframed things for a lot of people, and they started to think like that. And because of that, our clinic is doing really well now.
Wow, that's great. I mean, it's a big ordeal. I mean, I also had a clinic,
Yeah.
and yeah, there's steps. It was a smaller clinic than same kind of thing. And then
Yeah.
you think, okay, yikes, we could do this, and we sort of split the space, and then we work, these hours, or
Yeah.
maybe we're open every day, -1, but we're just a few more people,
Yeah,
and
it's the evolution is the craziest part of it. Like, how do I grow this sanely? I'm sorry, I didn't mean to
sanely,
cut
yeah.
you off there.
No, no, but that's why I was very tempted to hear your story. And then, we thought, okay, it'd be great to have services that we believe people would benefit from, that are available to them, so that it
Yeah.
is prevention, so very much the idea that you have, and you're succeeding in. So, but I think that is the model of the future. I think, I mean, they say in Chinese medicine, you don't pay. I'm not saying we can do it exactly, but you don't pay until you get sick. you know
Yeah,
right,
yeah, and
with the way of looking at it.
the idea that we invest in staying healthy, right? Some
Yeah.
people get it, right? I don't eat this, or this is my diet, or I go to the gym regularly, but they're still missing pieces, right?
Yeah.
And I think that's where we're starting to see. And I used to be big into the term biohacking, and then it became just like this kind of like alpha male BS. Uh, and I and now I'm
Well,
like, no, 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 no. This should be accessible to everyone, not just Silicon Valley bros.
uh,
And like even like the cold plunge, like we see oh, I'm a tough guy, I get in the cold water, and I'm like, yeah, but little old ladies can do it too.
yeah,
And it has, depending on why you're doing it, the outcomes you're looking for are very different.
yeah.
But it doesn't mean it shouldn't be accessible to everyone.
No, no. Do you want to get in a little bit on that? Because I just got back in summer. I was in parts of Europe where there's
Mhm.
lots of availability for that type of
Yeah.
water baths and all kinds of things. Tell us a little bit about why would people want to do it? What's the benefit? What's
Yeah,
the
yeah.
really?
So this was funny because I was recently interviewed, and they interviewed a physical therapist who happened to work at the medical conglomerate, let's call it, that sponsored the news. So guess who got their title included, and guess who didn't? So I was just the owner of the place, and this was Dr. So and so.
Right.
But she said there's no research on it. I'm like, wait a minute. I had a whole bunch of articles on PubMed that I was ready to share, but in a 10-second clip, we didn't go through it. Um, Within that, one of the biggest things that we're using it for is reduction of inflammation, right? And that's
Yep.
off the bat, right? And it's been used for nearly forever. We think there is something about putting ice on forever, but we're talking about brief cold exposure. Water under 60 degrees Fahrenheit seems to be enough to do the trick. And within that, we're basically acting kind of like a pump, right? That cold constricts the tissue, forces inflammatory markers like cytokines, lactic acid, what have you, back into the bloodstream to get circulated out. Now, when we get out, there's a rebound. Our body wants to warm back up. It opens up those blood vessels, pumps fresh blood in. Hopefully, that blood is properly oxygenated and has enough nutrients in it from going to the intestines, and helps reduce inflammation and repair tissue. Um, People are also using it for the mental effects, right? It does stimulate neurotransmitter production. I've seen something that's saying it helps with neuroplasticity as well. Um, but we're seeing a lot of benefits that people just get a rush and they feel better after it.
Mhm.
So we like to use it for a bunch of reasons. I honestly have a whole body cryotherapy machine,
Mhm.
and we had that first, believe it or not. And I will say the hit that you get of the cold is worse in, 40-degree water than it is in a negative 256-degree liquid nitrogen cooled chamber. So the benefits are similar. A lot of musculoskeletal, a lot of workout recovery is mainly what we're seeing in the clinic. We're also seeing a lot of chronic illness injury.
Yeah.
So chronic Lyme, long COVID, and a lot of those people are getting some good success with cold exposure therapy.
Mhm, mhm. As in like the people who took the shot and may have had some of the impacts as
We've
well.
both sides of it. So what I'm seeing is more people that have had long-term effects from getting COVID. But I do have a couple of immunocompromised people that you know I think given the time might have made the right decision to get the vaccine, but had a vaccine reaction. And recently, the one that I'm thinking of right off the top of my head, got the first two, was fine, got the third, and that's where she had the big reaction. And she had chronic mold infection. She has chronic Epstein-Barr, and we're talking about things that like may sound common to us, and some Western medical practitioners say that doesn't happen, right?
Mhm.
Okay, well then why is this patient falling apart? Yeah,
Yeah, it seems to have instigated an acceleration of whatever is latent in people, which is why there's so many turbo cancers and
It,
everything.
it's so it's such a weird it's such a weird thing. And we're going to look back at this at 30, 40 years from now and go, wow, we didn't even know what the hell we were doing.
What would your life be like if you were pain-free? If you were one of the millions who suffer from chronic pain, the thought of just one day without it may seem impossible. This is often because conventional medicine tends to fall short in the treatment of pain, opting to prescribe pills or recommend surgery rather than getting to the root cause of the problem. But if you are suffering with emotional or physical pain, there is hope. Join the founder and CEO of Bowen College, Manon Bolliger, live online for your body-mind reboot. Learn how to listen to your symptoms and get to the root cause of your pain. Plus, be trained in basic Bowen therapy moves so that you can reboot your body for optimal health. You don't have to live in pain. You can heal. Stop the pain pill cycle by visiting www.yourbodymindreboot.com to learn more and to register.
Is what I think.
At least I think that's coming out now, actually. At least, now that there's finally a bit of research that is coming out,
Hmm.
it seems to be showing. Yeah, it's quite troublesome. And I think, important thing is that there are solutions that help people, so I think doing the cold therapy is
Mhm.
really important. What else do you use water in any other way
I,
or
no, our clinic, we really,
hydrogen?
so hydrogen is a weird one. I have
Yeah.
a friend. So we have red light therapy, and I have a friend that I know through a business organization who developed a machine that's red light therapy, inhaled hydrogen. It's a zero gravity table that has full spectrum electromagnetic frequency pumping through it. He paid a sound engineer to do binaural beats and guided meditation. And that unit is very expensive. He's trying to sell it to people worth, 8 to 9 figures.
Yeah.
But hopefully there'll be some clinic models coming out. Hydrogen's a really great one. I love that stuff. It's interesting to see in clinical practice. They do use it in injections into acupuncture points.
Mhm.
We
Really?
know it. Yeah, yeah, yeah.
I
So
didn't know that.
some crazy stuff. Even ozone. But ozone is kind of controversial here in Maryland, unfortunately.
Yeah.
But within that, that as far as wet therapies, our clinic simply doesn't have the plumbing. So
Right.
our cold plunge tub is pretty easy. We run a drain out the door to clean the tub. Yeah, we refill it from a hose from the sink. But I did want to bring in float tanks. We were running out of square footage very quickly, maybe in the next incarnation. And I love float tanks so much for the mental health aspects as well. Um,
And what about the hydrotherapy, where you're mixing the cold and the heat and also the
so
electrical charge and stuff?
so we don't do any electric current with our
Okay.
setup, but we do contrast therapy. So a lot of
Right.
times we'll have people do uh either cold plunge or the cryotherapy first, go in the sauna, and then get back into the cold plunge. And the idea is we're treating the body almost like we're creating an artificial pump, right? How
Mm,
strong can we get everything to constrict and then dilate and then constrict again,
mm,
to kind of pump in and out fresh blood and
mhm,
stagnant blood for that.
mhm. So how do you so like how do you do a treatment plan? For example, somebody comes in with whatever it might be,
Yeah.
name it.
So there's a little bit for like, to borrow a term from Western medicine, there is a little bit of triage. We
Yes.
do have a lot of people that come in and they want a specific service, right? This is what I want. Okay, we're more than happy to accommodate. If you want more or you want to have a conversation with us, we're here. We do have a lot of people that come in and they'll do a consultation. Well, you've got so many things. I read 10 of them and they all look like it's something I could use. And that's where you start to get into the questions of like, well, what are your goals? Like,
Right.
let's really figure out what you're trying to do here. Because look, if you had a hip replacement, we can definitely get you out of some more pain, hopefully increase mobility. We're not growing a new hip, right? But within that, how well do you tolerate the cold? How well do you tolerate the heat? how
Right.
how how much time are you willing to give us a week? What's your budget is even a big question, right? So with the acupuncture, at least I can hopefully, fingers crossed, bill insurance.
Mhm.
With everything else, these are not services that are recognized by the American healthcare system. So you're not,
The care
you know
system.
yeah, and can we get you the most bang for your buck? And that's really where we're trying to figure that out.
Mhm.
So because we're one of the few clinics that are combining things in this way, there is a bit of a learning curve for us too.
Yeah.
And you're really trying to be as honest and open with everything, but how much can I do for you is going to depend on how often you can come in, what your budget is. But we
Mhm.
want to be open and honest. And if we get people to come in at least for the acupuncture
Mhm.
and maybe do the membership, they're able to come in once a week, get both acupuncture and combine that with the service, and then we can kind of play. Oh, try this service today. If this rocks your world, we'll keep doing it. Right. One of
Mhm.
the things that we do is exercise with oxygen therapy. We used to have a hyperbaric machine, and hyperbaric is great. To use it the right way, you probably need to be in it for an hour, 5 to 7 days a week. Who's got that kind of time?
Mhm.
So, exercise with oxygen therapy gets about 433% more oxygen into the serum of the blood by using a weird trick of starving your red blood cells, to put it bluntly. So, you'll
Mhm.
sprint at high altitude air, 14% oxygen, and you
Mhm.
start to lose the oxygen on the red blood cells.
Mhm.
Triggers your blood to become more basic. Off
Right.
gases CO2 better, absorbs oxygen better. You then recover it pure oxygen, and not only recover that on the red blood cells, but you stockpile it into the liquid part of the blood. You do
Mhm.
that for cycles, keep increasing the amount of oxygen. And instead of only lasting for about 3 hours, which is what a hyperbaric session will do, this will last up to 3 days. So we've
Mhm.
able to give you more service in a shorter period of time.
I didn't know that trick. That's great.
It's a weird one, and I honestly, when I heard of the company, I called them and I believe I said, "You're telling me you can get more oxygen into the blood than a hyperbaric?" And I think that's bullshit. And then he sent me a bunch of studies. I mean, that's really what we want to see. We want to make sure that we're, as purchasing the equipment, that we're not selling something that we can't deliver on.
Mhm. Mhm. So Yeah, this is great information. So what is like a great day at the clinic for you? What does that look like?
So we're like, knock on wood, we've been pretty busy, and as I've been there 8 years now, and I find myself, and this was a hard pill to swallow. If I want to help more people, I'm doing less of the clinical stuff.
Mhm,
So our team is really growing, and even today, I had a busy day. I think I treated about 10 people,
mhm,
but the clinic saw close to 35. So
mhm.
that's a good day, right? Where I have enough people to help with the work,
Yeah.
and I can come do things like podcasts and write books and try to get
Yeah.
articles published and those kind of things to advance the field, hopefully help more people,
Mhm.
and feed back to the clinic, because at the end of the day I have to keep those doors open. you
Yeah.
know
Yeah. Well, that's the balance, and it's also adjusting to the change, right? It's like you just have
Absolutely.
to cut down to grow, then it changes, and it's like it's quite a dance. It's so
It is, and it's so unique for everyone, because I have friends that have been out as long as I have, and we're all having this conversation, but the manifestation of the change looks different for everybody.
yeah. 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 Oh, very interesting. So what about a case or a something that's completely surprised you? I mean, not surprised the typical conventional medicine allopath, right? That who doesn't fully necessarily believe that anything can be done. But you, with plenty of experience that knows people get better.
I
With,
one of the things that still weirds me out, and I just got a phone call. I normally get 2 phone calls a month, is what I've been averaging lately,
okay.
and it's for breech birth.
Okay.
And it's something that a lot of midwives and doulas know, and it's something that there is actual research on. We burn moxibustion on a point on the toe, and
Mhm.
there's about a 70% success rate of flipping the baby. And it's such a weird niche thing, that so many people don't know. And even, let's say, with schooling, I've probably been in and around the field for almost 27 years.
Mm.
It still amazes me at how well it works.
Mm.
It's I'm literally not even penetrating the surface of the skin on the mother. I'm heating a point,
Yeah.
and
Yeah.
somehow that baby knows to turn. And every time it happens, it's still like magic to me.
Mm.
I
Yeah.
I I know I don't know if I was going in the right direction with the answer
No,
there.
absolutely. No, I was trying to think what point that would be. So,
So it's bladder 67. It's on the pinky toe.
okay. Yeah.
Uh, my teachers would add a second point in, which is like the number one point for women, which is spleen 6. You can't use that in the first couple of trimesters, if you're pregnant, but at the end, it works pretty well.
Mhm, mhm.
And it is such a great thing. I Saturday, I have somebody coming from 2 hours away for me to do this for 10 minutes.
Mm.
you
Wow.
know
Yeah. So what about cupping? What is, because you have a book on it.
yeah,
Maybe
yeah.
we have like 5 minutes left. Why
You
don't
you
you?
you got it. So one of the things I absolutely love about cupping is this
Yeah.
is everybody's medicine, right? This is over 4,000 years old. First mentionings, we don't even know exactly where it came from. We know it was in the Ebers Papyrus in 1515 BC in Egypt. There's texts in Persian going back several thousand years. Hippocrates wrote a ton about it, and it's all over the world. And when I was teaching at an acupuncture college in Manhattan, we had a lot of international students. Every single one of them would come in, didn't matter what part of the world they were from, whether it was Africa, Asia, Russia. Grandma used to do that. And slightly different variation, but basically cupping is creating a vacuum and sucking the skin up into that vacuum. And what we see happening is we create a space between the skin, the fascia, and the muscle, and
Mhm.
any stagnation, any lactic acid buildup, any metabolic waste that's in that tissue gets drawn into this space that's created, and our body has a better time cleaning that up. And what ends up happening in a closed system is we pull fresh blood into that tissue below it. And I mentioned that I like studies on things. We've had in the last few years, from 2017 to 2020 to 2022, systematic reviews on cupping that are showing that, like, yes, it is 100% effective. Well, not 100%, nothing's 100%, but yes, it will definitely help with neck pain. It'll definitely help with low back pain. Traditionally, we're using it for allergies. We're using it for stress. We're using it for respiratory disorders, digestive disorders. And this is something that if grandmas around the world can do it, you can do it at home too, which is why I have a book coming out in January to teach people how to do it without fire. So this is the safer version. It's cost effective. It's something that you can do on your loved ones. It's something you can do to yourself, depending on where you're going to put the cups. And it can positively impact your life.
Mm-hmm. And you do have to use sort of the cups that you can get from Chinatown, basically.
Yeah. I mean, if you want glass cups, I probably have a few of the silicone ones in reach that you literally just press on the body. So technology has really advanced the 4,000-year-old, but you can still do it with the good old fashioned. I have a couple of buffalo horns that I keep at the office just for fun. You can do it with bamboo. You can do it with there's a colleague of mine that is on Instagram as Art of Acupuncture, who I've seen him do these beautiful champagne flutes on people's back, which just for fun. But there's a lot that can be done, and it's a simple technique. And once you have it, you own it. It's yours for the rest of your life. Yeah.
Great. Well, so name of the book again?
So very simple, The Cupping Book.
The cupping book.
I said, why beat around the bush? Let's call it what it is.
Exactly. I'm sure there's not another one.
Surprisingly, there is not.
Great. Okay. Well, anyway, thank you so much for sharing also the business part of a successful practice that is really focused on helping people, because I think it's not that straightforward.
Nothing in healthcare is straightforward.
And I think it is kind of the model for the future. So it is, we need to be thinking about maintenance, health, prevention, all of that.
And I think we're riding that current too. Yes, I believe that we're going to see a lot more home devices that'll get us in that arena too.
Yeah, I think so too. It's true. And more conscious people.
Yes.
I've always thought, we're supposed to be teachers that teach about health. At least that's the idea of the notion of doctor, right?
Yeah. Yeah.
Yeah. Let's do it. The more conscious people, the more people that will come for help if they need it. At least they know their bodies can heal. They can start somewhere. So I think that's great. Okay, well, thank you so much.
Oh, thank you. This was so much fun.
Okay. Bye.
All right, take care.
Thank you for joining us at the Healers Café. If you haven't already done so, please like, comment, and subscribe with notifications on, as I post a new podcast every Wednesday with tons of useful information and tips for natural healing that you won't want to miss.